I'm Dr. Amy Giedt, and this is Patti. We're going to be talking about endometrial biopsies today, otherwise known as EMBs.
What actually is an EMB?
An endometrial biopsy, or an EMB, is when you take a sample from the lining of the endometrium, or that lining of the uterus.
Why would you do that?
A lot of times if women are having heavy periods, abnormal bleeding, we'll want to make sure that there's not abnormal conditions causing that, and the endometrial biopsy will help us diagnose some of those conditions.
What would you consider abnormal bleeding?
A lot of times if you're having really heavy periods or a lot of bleeding in between your periods, those would be some situations where I would think an endometrial biopsy may help us out.
Okay. Is this something you do in the office, or is it hospital, or?
Absolutely, we would do it in the office, and it's just a real quick procedure. A lot of times we'll have you come in and prior to your visit, take a little bit of ibuprofen to help make the procedure a little bit more comfortable. We would then do things like we do for a pap smear. We use a speculum to look at the cervix, and we'll use some betadine to just clean that cervix off, and we'll use the endometrial biopsy pipelle, which looks like a long skinny straw, and we'll insert that into the uterus and pull out a little tissue sample.
Does it hurt?
A lot of times you'll have some cramping with the procedure and a little bit afterwards as well. You can also expect to have a little bit of bleeding.
Okay. And you said ibuprofen for pain, and then will I need to be taking that after the procedure too? Or does the cramping stop as soon as you get done? Or?
Pretty quickly the cramping does stop, but you can continue to take ibuprofen as directed.
Okay. How about bleeding? I know you said that was a symptom to get an endometrial biopsy, but am I going to bleed afterwards too?
A lot of times you will have some spotting or bleeding after the procedure. As long as it's not real heavy, like soaking through a pad an hour or every 2 hours, then it's okay to just watch that.
Okay. And then what are you actually looking for with the sample? Is this for cancer, or what are we looking for?
Yeah, that's one of the conditions that can help us diagnose. It looks for cancer, precancerous conditions. It can also diagnose infections, things like that.
And then if the results are normal, where do we go from there?
It just depends on what we think is causing the bleeding.
Okay.